Hello everyone, and welcome to the Molar Academy. Today, we're continuing our series on medical emergencies, specifically focusing on a very important topic, syncope, commonly known as fainting. This is one of the most frequent emergencies we encounter in dental clinics, so understanding it is crucial for all of us in the field. Let's start by defining syncope. In simple terms, syncope is a temporary loss of consciousness that occurs when there is a sudden drop in blood flow to the brain. When the brain doesn't receive enough blood, it can lead to that fainting spell we see in patients. But how does such a seemingly simple thing lead to fainting? The answer lies in a few key triggers, which we'll explore together. There are 5 types of syncope, but today we'll focus on 2 of the most common ones you're likely to encounter in practice. 1. Vasovagal syncope. This is the most prevalent type. It often occurs in response to stress or anxiety. When a person feels stressed, their parasympathetic nervous system kicks in. This overstimulates the vagus nerve, leading to a decrease in heart rate and blood pressure. When blood flow to the brain diminishes, it can result in a loss of consciousness. 2. Orthostatic syncope. This type occurs when there's a sudden change in body position, like standing up quickly or standing for long periods. Gravity causes blood to pool in the lower body, which can lower blood pressure and result in fainting. Now that we have an understanding of what syncope is and its common types, let's discuss what might trigger it. Common triggers include emotional stresses such as fear or anxiety, especially in patients who may be nervous about their dental appointments. Other factors like dehydration or prolonged standing can also play a role. Recognizing prodromal signs, those warning symptoms that appear before syncope, is vital for managing the situation effectively. Signs to watch for include nausea, sweating, visual disturbances like blurred vision, dizziness or lightheadedness, hearing changes like ringing in the ears. Being aware of these signs can help you prevent an episode of syncope before it happens. Now, let's understand how to manage patients and prevent syncope. There are crucial steps to take before, during, and after treatment. So, before the treatment, always begin with a detailed medical history. Ask your patient about any previous fainting episodes, their meals, and their hydration status. Create a calming environment to help reduce patient anxiety. During the treatment, use appropriate anesthesia and take care to administer it slowly. Monitor the patient closely for signs of impending syncope. After the treatment, gradually change the patient's chair position, allowing them to sit for a moment before standing. Offer assistance and support if the patient feels unsteady. Now, let's assume that despite your efforts, the patient faints. What should you do? The first step is to stop everything immediately. Clear the field, remove any instruments from the area, and call for help. Next, position the patient. Lay them in a supine position, which means flat on their back. You might ask why we don't use the Trendelenburg position, where the legs are elevated. According to the recent guidelines from the American Dental Association, this position can sometimes worsen issues like increasing intracranial pressure and breathing complications. Supine is often the safer option compared to it and does the job. The third step is to check the patient's pulse. Generally, pulse is present in cases of syncope, but it's essential to be prepared for any changes. Next, focus on airway management. Ensure the airway is clear by tilting the head back slightly and lifting the chin. This helps to prevent the tongue from blocking airflow. Following that, assess breathing. Check if they are breathing normally. If they are, provide oxygen if necessary. If there is no breathing, it's crucial to activate Emergency Medical Services, EMS, immediately. Now, everyone should know the AVPU scale, which helps in assessing the consciousness. A stands for alert. The patient is alert and responsive. V stands for verbal. The patient responds to verbal commands. P stands for pain. The patient only responds to painful stimuli. U stands for unresponsive. The patient shows no response at all. In addition, you should take care of some other factors like loosen any tight clothing, maintain a comfortable room temperature, allow the patient to recover in a supine position before attempting to have them stand. Check their vital signs and assess whether they are fit to leave. By understanding and following these steps, you will be better prepared to handle syncopal episodes effectively. Thank you for joining me in learning more about this crucial topic in dental emergencies. If you found this information helpful, please give it a thumbs up, subscribe, and share it with your colleagues so we can all stay informed and prepared.